On this episode of the Paw Report, we ask the question, what happens when your pet needs an amputation? Deciding to go through with surgery can be difficult and emotional for pet owners. Coming up, Dr. Hadley Gleason from the University of Illinois Veterinary Teaching Hospital will join us to talk about the why and how pet owners can adjust to living with this life-changing event.
It's almost impossible to imagine life without internet today. It keeps us connected to work, school, and loved ones, no matter where they are. Fidium Fiber Internet now serves over 1 million locations, providing reliable, consistent service that keeps these connections strong. From vibrant cities to quiet rural areas, fiber broadband is a key driver of economic growth. Fidium is dedicated to supporting communities and enhancing lives through this essential technology. Learn more at fidiumfiber.com.
At Tender Touch Grooming, we groom dogs of all sizes and breeds tenderly. Our team pampers your furry friend with care, because every pet deserves a tender touch. Appointments are available via text at 217-317-9489.
The Paw Report on WEIU is supported by Rural King, America's farm and home store, livestock feed, farm equipment, pet supplies, and more. You can find your store and more information regarding Rural King at ruralking.com.
Dave's Decorating Center is a proud supporter of the Paw Report on WEIU. Dave's Decorating Center features the Mohawk Smart Strand Silk Forever Clean Carpet. Dave's Decorating Center, authorized Mohawk Color Center in Charleston.
On this episode of the Paw Report, we are talking about amputation, and joining us is a returning guest to the Paw Report, Dr. Hadley Gleason, and we're on location at the University of Illinois at the Veterinary Teaching Hospital. Thanks again for joining us on this episode.
Thank you for having me.
There are many reasons why, of course, amputation is our topic today, but there are many reasons why pet owners may be faced with that choice of having to amputate a limb. What are the different reasonings potentially?
Yeah, usually the reason why you might amputate a limb is when the cost of maintaining that limb, either from a health perspective, there's a cancer in that limb or an infection in that limb, or trauma that maybe precludes the cost or the time constraints of the client to be able to have their pet back home. So it's not an option we love to choose, but it's absolutely great to have for those pets that need it. Absolutely.
Now, when you say trauma, is that something like an animal may have gotten hit by a car, or maybe they were running in a wooded area and something may have happened? I'm sure you probably see lots of different types of trauma that could fall into that category.
Yeah, certainly. So being hit by a car is absolutely one. We see a lot of farm equipment trauma out here in central Illinois. Certainly getting out and getting loose and coming back home, days later. Those are situations where sometimes the damage to the limb is so extensive that we may not be able to fix it and have the dog go home happy and healthy with that limb, or maybe beyond the client's financial or time means to be able to do that. And so it's great to be able to offer this option to get the pet home, within a few days. On their way to recovery with minimal risks of having to do another operation or revision surgery later on.
How do you walk the human pet parents through that process when you're talking to them? I mean, do you do it alone? Do you have another team that maybe comes in and talks them through that process?
Yeah, absolutely. Usually what we'll do is we'll start with the doctor kind of communicating to them, and often it's what their options are, and often there's an array of options. Amputation, as well as in the case of traumatic cases, surgical repair or wound care for that dog. But sometimes, after discussing with the client, we decide that amputation is the best option. And some people receive it very well. We have a lot of three-legged pet ambassadors out there in the world. People see them a lot more often and can see that they live happy, healthy lives and otherwise enjoy themselves. But there are absolutely pet parents who it is a bit of a stretch for them. It's hard for them to stomach that. And so a lot of times we just want to be able to communicate to them why that's the best reason for the option for the pet. Maybe show them some examples of pets that do really well with amputation. Communicate, what the challenges might be of not pursuing amputation and what that would look like for the pet and their family. If they need more time, oftentimes it's not always an emergent decision. They can take some time to make that decision. And we do sometimes bring our social worker or have them communicate with other family members to kind of discuss that decision. We never want to push them into anything that they necessarily don't want to do. But sometimes it is the best option for the pet, especially in cases of trauma or cancer or infection.
Are all breeds good candidates for being amputees if surgery was the option?
Yeah, I think all patients are candidates. There are certain patients that do better with amputation than other, and generally it's going to be associated with a size difference. So little small dogs do really well on 3 limbs. They're able to pretty much right away run, jump, after their recovery period of about 2 weeks. They acclimate a little bit better than a big dog who has a lot more weight to carry around. That's not to say that an amputation is not an option for a big dog, but we're again always weighing the pros and cons of what are the benefits of getting an amputation in a big dog that has a painful tumor in their leg. Even though it's a little bit more challenging for them to get up, we may need to make some adjustments in their home, like getting nice rubber flooring down or having a harness that we can help them get up. That might still be a better option than letting them continue with this painful limb that has a cancerous mass in it. So it's always weighing pros and cons and trying to communicate that to the client and letting them make the best decision for their family and their pet. I would say that pets who have already been only using 3 legs, so sometimes dogs that have cancerous masses, or if they've had an infection or for some other reason they're not using one of their legs, it's much easier for them to adapt after surgery because they're already used to not using that limb and they've been doing prehab, for lack of a better word, and kind of getting around on 3 legs already. So those dogs tend to generally do quite well with amputations and recover very quickly.
Dr. Gleason, can you talk about the different surgical procedures that maybe that you've been involved in or that are done here at the University of Illinois?
Definitely. So as far as amputation goes, generally when you talk about differences, there's kind of 2 categories. One would be location of where the limb is amputated. And here at the U of I, and where I train, generally we try to, if we're not preserving any part for a prosthetic or anything like that, we'll take the entire limb. So that's removing at the level of the scapula or the shoulder blade and removing at the hip joint. There are some veterinarians who will do procedures slightly differently, but generally I feel that if they're not going to use that limb, the more kind of weight that we can take off of that forequarter or hind quarter, the better, the easier it is going to be for them to get around. The other options that we have are what kind of instruments are we using to do the surgical procedure. And so there's several different options. Here at the university, we've been doing a study looking at using electrocautery, which is basically using electricity to go through the tissues versus a machine that uses sound waves to go through the tissues. And so the sound wave machine is much, a little bit more niche, kind of more specialty item versus the electrosurgery one is a little bit more something that you would see everywhere else. And so we're testing to see is one better than the other for when it comes to blood loss, tissue damage, as well as speed of recovery and discomfort for those dogs.
When you go over things with pet owners, you do talk about alternatives. Can we talk about some of those, like limb spare surgeries, prosthetics? What are some of the general alternatives that you can share?
Yeah, definitely. And I think this is something that has a lot of attention on it because in human beings, it's very much the direction. If you had a limb amputation, you would likely be getting fitted for a prosthetic, getting fitted for some kind of other assistive device. And the challenge with dogs is that they don't necessarily know that they're supposed to use this assistive device. They're what is this that you've put on my leg? And so I think the challenges with those kinds of assistive devices in dogs is kind of the post-care. So Let's say we're doing a prosthetic, you have to have more limb available. So for a forelimb, you need at least a good portion of the radius or the forearm of the dog available to get the prosthetic to fit up above the elbow and have it fit well. Same thing with the hind limb. You need a little bit of the tibia or the shin bone available so that the prosthetic can fit over the leg and have a good fit to it. And then the dog needs a lot of significant rehab afterwards to kind of learn how to use that, be coached how to use that. And some dogs take to it quite well. Other dogs, you can spend a lot of money getting this custom prosthetic and they never learn to use it and they'd rather run around on 3 legs. There are other procedures that we don't do here at the university but are available, and they may have seen, our watchers may have seen on on TV, where they have ingrown prosthetics where they implant things into the bone and they can walk around. That's a pretty advanced procedure. And again, you need the right client who's going to be able to follow up and deal with any complications that it might have, and the right dog that's going to be able to tolerate that kind of procedure and the follow-up required. So they are great options, but I really counsel clients as far as what it looks like. It's not as simple as a person being able to put this on, put a prosthetic on, know what it's for, know what kind of exercises they have to do. There's a lot of buy-in from the client and the dog for these, and a lot of the time they might be just as happy with an amputation. Just depends on the client.
It's a big commitment from
it's a big
pet
commitment
owner, because like you said, there's therapy that goes along with that, and then there's training in the dog.
Yep.
I think we're all used to seeing the videos of a dog that gets one of those and there's like a little carriage behind them essentially on wheels that goes around with them. Now some dogs do really well, but that process is long to train them though, I would think.
Yeah, and so you see a 15-second clip of a dog that has a forelimb prosthetic. You don't see all the work that went into making that prosthetic, kind of acclimating the dog to the prosthetic, having them work through it. Some of the, like you mentioned, the little carts in the hind end, those work quite well, but again, it's patient selection. So a patient that's paralyzed in the hind end, where they're not really going to even notice that it's on for the most part, those dogs actually do really well in the hind end carts. But if they already are, if they're trying to use the hind limbs, or if they're otherwise irritated by it, the hind limb carts can be a challenge. But they're probably one of the easier assistive devices that we have to use.
Sometimes you also have to recommend potentially that amputation is not maybe the best route for someone to take. When are those circumstances, or when do you know if amputation just isn't right?
I think the cases that come to mind are where there's potentially another procedure that is equally available, equally cost effective, and equally efficient to get the pet back up and moving around. So cases that I can think of are hind limb procedures where the problem only affects the hip. And in that case, we can often do just remove the neck of the femur, the head and neck of the femur, and that dog can use its muscles kind of as a hip joint. I wouldn't recommend amputation for that dog because that procedure, both of those procedures are fairly easy to do. You could probably get them done at your local veterinarian, relatively cost effective, and you get to preserve that pet's leg. So if they have any arthritis or other issues in any of their other 3 legs, they have kind of a helper leg. It's not going to work as it would normally, but it's going to be better than having no leg at all. And so that's the only case where I would say I wouldn't recommend an amputation. But generally, I think amputations are always an option because they are, again, you can get the pet back to their life within 2 weeks. They're relatively cost effective, and they're efficient at removing the source of pain, removing the source of damage and disease without a lot of cost to the client. So sometimes that's just an issue where we're communicating with the client about what their means are, what they want for their pet, and trying to find the best solution for that.
If the client decides that amputation is the route that they're going to go, what can they expect leading up to the amputation and then day of surgery? What does that look like? Yeah,
generally, so here at the university, you can either have your dog stay the night beforehand or drop them off in the morning. They'll need to be fasted the night before, so no food after 10 p.m., just like if you or I were going into surgery. We don't want to have any food in the stomach. And then generally they'll drop their pet off. We'll make sure that everything is all set from a blood work perspective so that their liver, kidneys are functioning normally. They have good clotting function. We'll check all of that beforehand. And then we'll perform the surgical procedure here at the university. We'll use either of those 2 instruments that I mentioned earlier in the talk. We'll get them a call. They'll get a call when the dog goes under anesthesia. They'll get a call from when we wake up from anesthesia. After that as well, we're really into communicating here at the university. And after that, the dog will typically stay in the hospital 1, maybe 2 days for monitoring for fluids and pain management. And they'll go home sometimes with a little assistive sling that you can help them up in the front end or the hind end. But generally, most dogs are pretty good at getting up and getting around with a little bit of help, even 1 day after surgery. Dogs are so resilient. I always say they make us look so good at what we do because they're just so tough. And they want to get up and play, they want to please you, they want to eat, they want to do all these things. And so they recover quite well from this procedure.
Again, recovery, so then after that 1 or 2 days they go home. What's recovery look like at home?
Yeah.
Do you have to, pet proof?
A little bit. I would say for the most part we want them in a small area, so they have a pretty large incision, as you can imagine, and so we really want to prevent them from being too active and having that incision move and put tension on those sutures, on those stitches. So generally for the first 2 weeks they'll be enclosed in maybe a small bathroom or a crate, out to the bathroom to go outside to go urinate and defecate, and then back in. We may have you warm compress or cold compress the incision depending on where we are in the timeline of healing, and then they'll have to wear a cone as well. So the dreaded cone. But what I always tell people, it's just like having a toddler. You know, they're going to want to do things that they're not supposed to be doing, and it's our job as pet parents to protect them from that. So even though, you know, just like a toddler, they're whining, they're crying, they're upset about having the cone on, we know what's best. And the worst thing to happen, what we don't want to happen, is for them to lick or chew at that incision, introduce bacteria, open it up, because that, you know, opens them up to a longer course of recovery, which is just what we're trying to avoid with an amputation. So keeping the cone on for 2 weeks, or at least until your vet says that everything is in the clear, and then after that period, this dog can kind of go back to its life pretty much fully. There are some adjustments at home, like I mentioned, maybe putting some rubber mats down or making sure you have rugs if you have hardwood floor, just to make it a little bit easier. But that's generally for, you know, bigger dogs that have more other comorbidities, you know, arthritis in other limbs. A little dog can probably get around on a slick floor regardless once they recover.
Some of the complications you mentioned, you know, if a dog is able to get to it, lick it, chew it, not a good thing. But other complications that could be associated with this type of surgery?
Frankly, that's the main one, is the incision, and that's kind of the appeal of amputation, is that for the most part, once you get past that incisional healing period, this dog can go back to its life and the owners can go back to their lives. So that's the wonderful thing about it. We do hear, you know, you can hear some owners talk about, you know, maybe their pet has like a phantom limb syndrome where they're kind of trying to use the leg that isn't there anymore. But that's not something we really appreciate very often at all. And most dogs, it's not a painful thing for them at all. They're really very comfortable. And we use a lot of analgesics, so pain medications in surgery as well, to kind of block all the tissues as we're removing them, block all the nerves as we're cutting through them, so that this dog gets the best, most comfortable care that they can.
Here at the University of Illinois, at the Veterinary Teaching Hospital, that's where we're at as we're filming this episode of the Paw Report. You've been undergoing a clinical trial to look at different amputation techniques. Tell us about the trial that you've been involved with.
Yeah. So as I mentioned earlier, one of our master students and surgical residents has been looking at 2 different instruments used to perform the amputation. So one using electricity to cut through the tissues, and the other using sound waves. And so we're comparing, you know, is there a difference in blood loss? Is there a difference in pain after surgery? Is there a difference in damage to the tissues? Is there a difference in how efficiently and quickly the surgeons are able to get through the procedure? So we've just finished collecting our most of our data, and we're looking through it at this point in time with our statisticians, so everyone can hold tight on what we find. But it's been great to you know, help our young trainees kind of work through a project from start to finish, and then we're hoping that we'll have some quality data to either say, you know, one is better than the other, or that both are acceptable and they're both going to do a good job, and that both are good findings for the study.
Part of that trial has also looked at what's called pain scales. What are pain scales, and why was that another kind of facet of this clinical trial.
Yeah, absolutely. So one of the things really important, as I mentioned before, is making sure these dogs are comfortable. This is a major procedure. We want to try to attack that pain from multiple different levels, whether it's anesthetic, we'll often give them an epidural as well. We'll do some local blockades. The way that we're going to see, which procedure is better is we got to look at an outcome score. So for pain scoring, we're often looking at things like their posture, their facial expressions, how are they standing, how are they looking, and so that's one of a visual pain score. We do also do pressure pain scoring for this study, where we'll go along the incision with a small device called a Von Frey device that will apply pressure, and then we can see when the dog reacts. At what pressure is the dog sensitive? So that's another way we're assessing pain and discomfort in this study.
How long does this study go on, and how many subjects are involved in it? I would think that it's not just something overnight or a week or two that you can study. I mean, this is something that could also drastically change the way things are done here. So is it something that has a longevity to it?
Yeah. So we've been collecting, we have about 18 dogs that we have included in the study. We've been collecting those for about 1.5 to 2 years. And so we're going to look at this initial data and see if we have some results. We may end up including some additional dogs, but at this point in time, we've halted our enrollment. We did get a lovely grant from the American College of Veterinary Surgeons, so the ACVS grant, to help fund this research. So a lot of the additional monitoring, all of that stuff is not charged to the client, it's all charged to the grant. So we're able to provide a little bit of financial relief as well if clients are interested in joining in the study.
I think the magic question that pet owners probably out there watching or wondering is if my pet will live a happy, healthy life after this. Are they going to be in any sort of discomfort? Does it matter if it's the hind leg versus the front? I'm certain you get that question.
Absolutely. As far as hind leg versus the front, it is a little bit easier to recover from a hind limb amputation. That's just a question of body weight. So more of the dog's body weight, about 60%, is held in the front limb. We've got the head, we've got the neck. And so generally it's a little bit easier to recover from a hind limb amputation where there's less weight that one leg has to carry around. But generally, either forelimb or hind limb, these dogs do really well. I've even seen dogs that have 2 limbs amputated, either both front limbs or a front limb and a hind limb, and they can still live very happy, healthy lives. I think, again, dogs are so tough. They really are the best positive thinkers. They don't have any kind of negative self-talk, or they don't worry about, do I look different than the other dogs?
Right.
They're very positive. Once they're comfortable after surgery, they really want to get back at it and, do things with you and enjoy their time with you. They're just such great pets. So,
is there a secret recipe to how long it takes for them to kind of get used to this? I'm sure it's case by case.
Yeah. There was a study, it's a little bit older now, but that's saying it took about 21 days for a dog to get fully kind of reacclimated to being able to get up and use the leg. So obviously that's a median. There's some dogs that are going to be much quicker and they'll bounce up and be ready to go less than 20 days. And there's some dogs that might take a little bit longer. It's all going to depend on what other stuff does your dog have going on. And your vet can, of course, speak to you on that. They may not be able to give you specific numbers, but they can say, I think your dog might take a little bit longer because of A, B, and C. Or, I expect them to have a very routine recovery and maybe be up and at them, much more quickly.
Do amputations also take place on cats? I mean, I know we focused all of this on dogs, but is it rare for cats, or do you do the operation on cats as well?
Definitely do the amputation, the operation on cats. We generally see fewer cats in veterinary practice, especially in orthopedics, but that number is increasing. I think people more and more are likely to bring their cats in for care. We absolutely do this procedure in cats, and for the exact same reasons that we do for dogs. There's either some kind of incurable injury in the limb that we need to get ahead of, or there's an injury that, to care for it in another way would be really expensive, or really from a prohibitive from a time standpoint. The recovery and the convalescence would be months and months, and the owner and the cat personality maybe say that's not something that this cat's going to tolerate, and then they can again get back to their lives within a couple weeks.
Any support groups out there for pet owners that have had a pet that's had an amputation and they just need some other folks to talk to about?
Yeah, I'm sure there are. I don't know any specifically, but I can speak. We have a social worker here at the University of Illinois, and so if you have any questions about your pet's care, how to proceed, and you just need a sounding board to discuss that, she's available to kind of talk through those decisions. So that's a great service that we can provide here.
Always a great service. And as we wrap up our discussion today, I always ask our guest about a memorable story or a memorable client that maybe would just brighten our day, knowing that they had a great surgery and they're home living a happy, healthy life.
Yeah, let's see. I think the cases that are traumatic are the ones that are best for me, because those are pets that we're able to provide immediate comfort and relief. Removing that. So we had a pet that came in that had both, our referring veterinarian had diagnosed a radial fracture, so a fracture of the forelimb, but hadn't diagnosed that the elbow was also luxated. And so when the clients arrived, that was a much different prognosis for them. And so I think we were able to provide an amputation as an option for a pet that wouldn't have tolerated a really long, months and months of being restricted in a cage, months of being in a bandage. That's a lot for a dog, and that's a lot for the client. So I think being able to offer amputation as another option, that pet was able to have that procedure and be back to himself, in 2 weeks, as opposed to months and months of being back and forth here. Not that we don't love to see your pets, but sometimes it's nice to see them, enjoying their summer, without being here in the hospital all the time. So that's always great.
A great way to end it. Dr. Hadley Gleason is joining us today on the Paw Report, a new friend to the Paw Report. So we thank you for the wealth of information on those pet owners maybe facing amputation. So thank you for joining us.
Thank you for having me.
And thank you, our viewers of the Paw Report, for joining us on this episode on the road at the University of Illinois Veterinary Teaching Hospital. Until next time, we'll see you then.
Dave's Decorating Center is a proud supporter of the Paw Report on WEIU. Dave's Decorating Center features the Mohawk Smart Strand Silk Forever Clean Carpet. Dave's Decorating Center, authorized Mohawk Color Center in Charleston.
The Paw Report on WEIU is supported by Rural King, America's farm and home store, livestock feed, farm equipment, pet supplies, and more. You can find your store and more information regarding Rural King at ruralking.com.
At Tender Touch Grooming, we groom dogs of all sizes and breeds tenderly. Our team pampers your furry friend with care, because every pet deserves a tender touch. Appointments are available via text at 217-317-9489.
It's almost impossible to imagine life without internet today. It keeps us connected to work, school, and loved ones, no matter where they are. Fidium Fiber Internet now serves over 1 million locations, providing reliable, consistent service that keeps these connections strong. From vibrant cities to quiet rural areas, fiber broadband is a key driver of economic growth. Fidium is dedicated to supporting communities and enhancing lives through this essential technology. Learn more at fidiumfiber.com.